Hi everyone, welcome back to our YouTube channel. In this video, I will give a brief overview of the GCS, or Glasgow Coma Scale. The Glasgow Coma Scale is a system used to measure how conscious a person is through numbered scores. It provides information regarding how awake an individual is, their level of awareness, and their response to basic instructions. The Glasgow Coma Scale was first published in 1974 at the University of Glasgow in Scotland by neurosurgery professors Graham Teasdale and Brian Jennett. Since then, this scale has become an integral part of the assessment of and prognostication for altered mental status patients around the globe. The scale is used to assess how severe a brain injury is and is often utilized when an individual has just experienced a traumatic brain injury. The scale assesses patients according to three aspects of responsiveness: eye response, verbal response, and motor response. When the Glasgow Coma Scale was first introduced, it began as a 14-point scale, but since then, it has evolved into the modern 15-point scale. First, we will focus on the eye response assessment. Initially, an examiner would observe if the patient is opening their eye spontaneously. If so, their assessment of this behavior is complete, with the patient scoring a maximum of 4 points. If the patient can only open their eyes when instructed, they would receive a score of 3. If the patient still does not open their eyes when instructed by the administrator's voice, they would need to move on to assessing eye opening to pressure. The most common way of applying pressure is to one of the patient's fingertips. If there is a response, they would receive a score of 2. If the patient does not open their eyes to a stimulus of pressure, they score 1 point. Now, let's move on to the verbal response assessment, which is used to test memory and awareness of the world around them. The maximum possible score for this test is a 5, indicating that the patient can answer common questions like their name and date appropriately. If the patient is able to reply but their responses don't seem quite right, they would receive a 4. If the patient can speak but their responses to questions consist of seemingly random words that are completely unrelated to the questions, they receive a 3. If the patient is making incomprehensible sounds rather than words, they receive a 2. And if there is no response to questions, they score a 1. The final part of the Glasgow Coma Scale involves assessing a patient's motor response, which is utilized to test for damaged nerve connections to the brain. First, the administrator would ask the patient to perform a 2-part request, like lift up your hand and wiggle your fingers. If they are able to follow these commands correctly, they would score 6 points and the assessment would be over. If not, the next step is to assess a patient's response to pressure, observing whether or not they can pinpoint where on their body the examiner is applying this pressure. If they succeed, they would receive a score of 5. If the examiner applies pressure and the patient attempts to withdraw from the pressure, like pulling their arms or legs away, this would result in a score of a 4. If the individual partakes in abnormal flexion to that same pressured stimulus, whether it be by flexion of the elbow, wrist flexion, or internal rotation of the shoulder, this would result in a score of 3. If the patient's response to the pressure is abnormal extension, which can take the form of the head extending with the arms and legs also extended and internally rotated, this could indicate brainstem damage and result in a score of 2. Lastly, if there is no response, the patient scores a 1. The next part of the evaluation is to add all the patient's scores up from each of the 3 examinations: the eye response, verbal response, and motor response assessments. If the sum of the scores adds up to 15, this indicates that the patient is fully awake, responsive, and has no problems with their thinking ability or memory. A score of 13 or 14 correlates with mild brain injury, while a score of anywhere from 9 through 12 would indicate a moderate brain injury. Lastly, a score of 8 and below means that the patient has severe dysfunction of the brain. This table is comprised of a comprehensive list of responses and scores for the 3 assessments used in the Glasgow Coma Scale. There are other methods for making a prognosis. However, the total Glasgow Coma score can provide an extremely beneficial tool for experts to reliably measure a patient's level of consciousness and overall severity of their brain injury. Thank you for watching this video. Feel free to subscribe to our channel for more brain-related topics.